Let's look at the actual emergency use authorization documents. And if we look at Pfizer's to begin with, and we do what they just asked us to do for vaccine efficacy, you'll find in the confirmed cases that 8 people who got vaccinated were diagnosed with COVID. Okay? In the non-vaccinated group, 162 got diagnosed with COVID. And you do the math, and it comes up with a 95% efficacy. But you're not asking how often you're going to get COVID. Your question is, will it prevent me from getting diagnosed with COVID? Will it prevent me from dying from COVID? So let's look at the data. Their data, not mine. If we ask for confirmed COVID cases, you'll see that in the vaccinated group for Pfizer, there were 17,411 people. There you go. 8 people were diagnosed with COVID, which leaves you with 17,403. It gives you a value. Non-vaccinated, there were 17,511. 162 were diagnosed with COVID, which leaves you with 17,349 who did not develop COVID. Those are the numbers. If you're a scientist like me, you don't just look at those numbers, you statistically analyze them to ask a question, is there any real difference between those two groups? And it turns out that when you do that, there's not. It's not statistically different. But looking at that more important number, what was the absolute risk reduction? Well, remember this? 0.93 minus the difference in those vaccinated gives you an actual absolute risk reduction of 0.88%. If you ask if it cut down on the risk of death, well, here's the data. Page 41, Pfizer had 2 deaths, no vaccine group had 4. And what does this say? There is no statistically significant difference in the numbers of deaths, and they represent what is seen in the general population. So Pfizer, no statistical difference whether you get vaccinated or not, and no change in deaths. Let's look at Moderna and do the same thing. These are the emergency use document presented to the FDA that resulted in their being granted EUA clearance. COVID diagnosis, 11 people with COVID in the vaccinated group. Whoops, back that up. Richard, not so fast. In the non-vaccinated group, 185 over here gives you a vaccine efficacy of 94%. Okay? Same thing we do with Pfizer. Now let's look at the likelihood that it's not going to cause COVID, because that is, after all, the goal. So in the vaccinated group, there were 13,934 people. There they are. 11 ended up with COVID, which leaves you with 13,923. That's the rate. Non-vaccinated group, 13,883. 185 with COVID, therefore 13,698 did not. It is amazing what you can find if you go into the documents and dig. But you have to dig. Is there differences between those groups? No, there isn't. And more importantly, the absolute risk reduction, you saw 1.33% ended up with COVID diagnosis. That's there, minus 0.08% in the vaccinated group, and your efficacy is 1.25%, the absolute risk reduction. Deaths? Well, here they are, 6 in the Moderna group, 7 in the no vaccine group. And as you can see, again, the statement, there's no statistical difference, and it's what you would expect to see in this many people in the general population. This is my favorite vaccine because it gives us a little bit more view into what's really going on. Because they use 14 days, they use moderate and severe as the definition at 14 days, and at 14 days, also 28, but at 14 days, if we look at their data, 176 in the vaccinated group, COVID diagnosis, 513 in the non-vaccinated group. At 14 days, that gives you that efficacy of, thank you. Reading glasses, please. 66%. Okay? 28 days, they also have that data. 114 diagnosed in the vaccine group, 326 in the non-vaccine group, and the efficacy here is 0.65 or 65%, right? All right, those are the numbers reported. Let's tease it apart and look at the information we really want to know, which is the likelihood that you won't develop COVID. All right? So, using the definition of moderate to severe or critical COVID, at 14 days, you'll see 21,636 in the vaccinated group. 176 got vaccinated, leaves you at 21,460. Non-vaccinated group, there were 21,574 people. 513 got vaccinated, which gives you 21,061 who did not come down with COVID and didn't get vaccinated. If you do the math, lo and behold, this is science, there is a statistically significant difference, 0.05. Okay, absolute risk reduction, doing the same thing we did before. There's the risk, 2.38% in the non-vaccinated group at 14 days. 2.38 versus the vaccinated group, 0.81 is a 1.57% absolute risk reduction. Let's go one step more further. Let's go to the 28-day data, moderate severe, because they did, after all, report 14 and 28. And bear in mind, the 14-day data is what they got EUA approval with, not the 28-day data. They stopped at 14. If you go to the 28-day data, there were 21,424 in that group, 114 diagnosed with COVID, leaving you with 21,310. The non-vaccinated group, there were 21,199, 326 diagnosed with COVID, 20,873. No longer statistically different. 2 weeks later, gone. Okay? Absolute risk reduction, again, using these numbers, is 1.54% for the non-vaccinated group minus the vaccinated group, 0.53, is a 1.01% absolute risk reduction. We're going to go farther down the rabbit hole. We're going to go from table 14 to table 15, which also was not used for EUA authorization. Why is that critical? Because every time you do a clinical research study in more than one site, you have everybody making their decisions non-centrally. But everything goes to a central core lab where the people in charge make a decision, yes or no. And it turns out that the results are very interesting when you compare what everybody out there said versus the central lab, which is even mentioned in the EUA document for Janssen. And all you had to do was go one table further in the EUA documents. So EUA non-centrally confirmed, looking at moderate to severe critical COVID, versus the centrally confirmed, which not only included moderate and severe critical, but included the mild cases. At 14 days, there were 176 who were diagnosed with COVID. The central lab at 14 days, that dropped to 117. They didn't make as many diagnoses of COVID. In the placebo group, 513, but in the central core lab, no, there were only 351 who met the definition. At 28 days, non-central, everybody, 114, but the central core lab said nope, nope, 66. 326 in the placebo group, but in the central core lab, no. There were only 195. Those numbers are significantly different as they drop the number of cases by 32 to 42%. Those numbers weren't used to determine whether these drug vaccines should be EUA approved. Here's what really happens when you compare all the things I showed you. In Table 14, non-central lab, moderate and severe, these are the numbers. Go to the centrally confirmed, these are the numbers. As we look at this information back to this Johnson & Johnson vaccine, you'll see that there was a difference that appears to be somewhat significant in the deaths, even though not in the COVID cases. But what I want you to pay attention to is that in those who received the vaccine, of the 5, 2 were an unknown death. That's 40%. Of the 20 that died in the non-vaccinated group, 14 or 70% either were unknown or they just simply said it was COVID because they had a positive PCR test, which doesn't mean it was from COVID. In fact, what you should notice is that all 7 of the ones that had COVID that died had comorbidities, and they were all in South Africa. And despite that and those numbers, there's no statistical difference, as they say in their own documents, between the number of deaths seen in this group versus the general population and what you would expect to see. What you will see, and they put this in here, are the thromboembolic events and the neurologic events that are side effects and consequences. So they covered their rear end. It's in the EUA documents. This should come as no surprise. The inflammothrombotic response that I said would occur in 1994 has been validated by SARS-CoV-2 and COVID-19. Trust me when I say this is not the method I wanted to confirm my theory with. Notice the side effects. 4 people had convulsions, ringing in the ears, tinnitus, and blood clotting. You could look at a whole variety of factors, and a ton of questions come up, but one question that repeatedly comes up is, if I've had the infection, is there a benefit in getting vaccinated? And the emergency use documents, whether it be Pfizer's, Moderna's, or Janssen, all say there is insufficient data to make a conclusion about that. If you look at the important data, looking at Pfizer, Moderna, the Russian vaccine, Janssen, and AstraZeneca, and you look at this vaccine efficacy data, and you look at the absolute risk, and the number of people that need to be vaccinated, and then you combine everything, what you see is really an efficacy that ranges between 0.8 and 1.3%. And for this, we are vaccinating everybody on the planet and not allowing people to be treated by doctors for the disease or for the infection.